Well, hello, Emory families. It's our Family Friday webinar series, and we're happy to have you join us today. We're going to be talking about immunizations. I'm Bridget Guernsey-Reardon with the Office of Family Programs, and I'm happy to host today. And we'll be talking with you about this important topic. We have experts here to talk with you. We'll have some folks that are notice on the side that will be answering questions in the Q&A. Like always with our format, the Q&A will be a place that you can ask questions individually. We will try to answer those live. And I also may interject as we're presenting and put those questions out so that everyone can benefit from hearing about them. And so again, this is June 3rd, 2022. We know primarily this is class of 2026 families, but we also know there's transfer families and other families that might have an interest in this topic. You might be watching this recorded at a later date. So as always, if you have any questions, you can always write family@emory.edu. I'm happy as a family programs person to look at those questions and triage those and get you the answers that you need. So that is our beginning. I'm going to give it to my colleague, Charlotte, who will introduce herself. We've got a lot of material today, so we have a lot of slides, but the best part is it's a lot of detail, it's a lot of good information. You can go back. As we said, this is recorded. It'll be on New Student Programs website, Family Programs website, and in the Family Portal. So there's a lot of places for you to see it. You might even want to go over it with your student. So I'm going to give it over to Charlotte and let her take it over.
Thank you, Bridget. Welcome, everyone. I'm Charlotte. I am a nurse. I work in student health services, and I manage the immunization compliance, travel medicine, and allergy programs. So here is our office, our clinic. We're on Clifton Road, 1525, right opposite the Rollins School of Public Health. You can access us from the street. There's 66 steps to get up to our building. And we're on the second floor. So if you access us from the street, that's what you'll see. If you're going to drive to see us, you're going to come around the back behind the building and enter through a parking garage with a big sign that says Emory Clinic. And we're on the second floor, which is the same floor that when you drive in on the parking garage. Important phone number to reach us, 404, it's on the screen. And our website has got an awful lot of information that can probably answer a lot of your questions. I encourage you all to visit the website, studenthealth.emory.edu. Our hours, 8 to 5, Monday through Friday. We do have a Saturday clinic during the fall and spring semesters from 10 to 1, which is urgent care only appointments. And in the summer, we're just open 8:30 to 5 during the week. You can always call that phone number. I would encourage you all to put it into your phones because there is after hours people that will follow up with you. So you can always reach someone with student health 24/7. So we will be your medical home while you're here at Emory. We provide quite an array of services. We have dietitians, registered dietitians on our staff that can provide nutrition counseling. We do LGBTQ care. We'll provide allergy shots, immunizations, travel medicine for those that may be studying abroad or doing some sort of Emory program overseas or even traveling to possible third world countries for fun. That's my wheelhouse. We do telehealth appointments. We, of course, will track all of our medical records. We provide primary care, women's health, and then also psychiatry. Psychiatry is located on the first floor of our building. So I'm going to talk about immunization requirements. Emory University has a very strict immunization policy. We're very proud of it. We do this to protect you and the faculty and staff here at Emory. Immunizations are one of the biggest success stories of public health. Our campus is located right across the street from the CDC that develops all of the direction and the research on immunization. So the immunization policy is quite strict at Emory, and we expect every student to abide by its policy. You have to be compliant with our required immunizations, which is guided by the CDC and ACHA, American College of Health Association. It's all part of your onboarding requirements, so you are safe when you arrive on campus. And I encourage again for you to go to our website. There's a great video that you can watch that will walk you through the whole process of providing the information through the portal so that we can verify your documents, ensure that you're fully compliant before you arrive on campus. So on our website, you'll find the health form, the immunization form, and this is the first page of the document. It's a 3-page document. There's 2 different ones. One's for those of you that are not in a health science program, and those that you may be in the undergraduate nursing program would use a different form. But this is the one that most of you will be using for the non-health science program. So what you'll want to do, go onto our website, print out our immunization form, take it with you to your provider to have them fill it out. Or you want to get a verified immunization record that contains all of the required vaccines that are listed on our form. Complete your tuberculosis questionnaire, enter your immunization dates, and then upload the immunization records or the Emory immunization form. And then you'll have completed all of the steps and we'll take it from there. The required immunizations that you will need to have in order to be a student at Emory University include COVID vaccine, and that's the primary series and the booster dose, 2 doses of measles, mumps, rubella, 2 doses of varicella, which is chickenpox, a complete hepatitis B series, seasonal influenza vaccine, and I'll talk more about that in a little bit, a tetanus, diphtheria, pertussis vaccine. And then if you are residing in the residence halls, which I know all of you as first-year students will be, you'll need a meningococcal vaccine, the ACWY meningococcal vaccine. So I want to walk through with you how to access the student portal. Now, the student portal is essentially your electronic medical record. And this may be for some of you the first time that you've had to maneuver through an electronic medical record. So this is a very important information because this is how student health communicates to students. And you need to know how to, of course, input your immunization records, but additionally, how to access the messaging that providers may message you when you use our clinic, or if you have health information questions, how do you reach us so that a medical professional can answer your questions? So you'll go to our website, studenthealth.emory.edu. You'll go over to the right-hand side where it says click quick links. Click on the drop-down and select the patient portal. You're going to sign in with your net ID and your password. You'll have to put in your date of birth, and then you're inside your electronic medical record, or what we call the portal. Greg Dooley is our test patient. I'm not divulging any private information of a real student here at Emory. He's our sort of dummy patient that we use. So this is what Greg Dooley's portal looks like, which is about what yours will look like too. And then let's go to our next slide. So to start with your immunization records, you're going to go to the portal, you're going to click on forms on the left-hand side. Then you're going to click on immunization form in the middle of the screen there where the arrow is pointing. Then what you're going to do is you're going to have your immunization record next to you, and you're going to input all of the dates of those vaccines as indicated on our required immunization form. You're going to put the dates right into your portal. And just scroll down until you've completed all of the required vaccine date entries. Then what we need you to do is upload the form. If you aren't using the Emory form, you still need to upload your official immunization documentation. We need to be able to verify the dates that you've entered against an actual record. So then you'll upload the form. And then what happens is that information goes into a queue. It goes into a verification box. My team is monitoring that box. We're not a huge team, but we're working very, very hard to be able to process your document within 3 days after it's gone into the queue into this box. Once we verify your records, we're going to message you through the portal with what, if you're a completely fully compliant, welcome to Emory. If there's still things that we're missing, if maybe we have some questions. Then what you'll want to do is be sure to go and check your portal messages. So you know what has happened to, has your record been verified or are there things missing? So again, you go in, you sign into your portal. You click on messages, which is on the left-hand side of the screen. Then what you're going to see is you're going to see some secure messages in your box. If we've finished verifying your records, there'll be a message in there. And you can see if you've read it before or not. We can also tell if you've read the message or not. So you'll click on the message, you'll open it, and then it's going to tell you, we'll go to the next slide. And it's going to tell you, are you fully compliant? What the next step is. Maybe you're all done and you're all ready to come, you're fully vaccinated and ready to move in to the residence halls. If you have a question and you can't understand why our requirements are what they are, whatever the question may be, we want to hear from you. What you'll want to do is compose a message in the portal, click on new message, then click on immunization compliance team. That message will go to another box. We have more people monitoring that box and we'll answer your questions. It's very important that you know how to communicate through your portal because that's how we will be communicating to you. Again, you'll want to look to see if you have unread messages. And I can tell you what sometimes happens, and I know you're all very bright, extremely smart Emory students, and you wouldn't do this, but we see this sometimes. We send messages automatically. We're going to send a message on June 20th and again on June 27th if you haven't met our immunization requirements. We're going to send the message through the portal. If you haven't read the message, that's not our problem, that's your problem. We need you to read those messages because we need you to know if you haven't met our requirements, there will be consequences. And the consequence is going to be you'll have a hold on your account and you won't be able to register for classes. Now, if you, okay, this is again how to communicate with us through the box. I think we can skip that slide. If you want to know what your status is, if you've entered your dates and you're wondering, well, where are these people processing my records? What has happened? You can also go and check your status in your immunization record through your portal as well.
And Charlotte, I want to interject
yes.
here because you've done such a great job of talking about the portal, just so that families know this really is the main place for students to communicate with Student Health Service. And so throughout the year, I may get calls from some of you who say, gosh, you know, my son has this, you know, this problem and he's trying to find out how to talk to Student Health. It is really, really through the portal. And so more times than ever, I will come back and say, that's going to be your quickest way. That's how those of us who are staff members communicate to Emory Healthcare. And it really is the quickest way to write up what you have, what the issue is, and then someone is going to respond relatively soon. It's quicker than a phone call. It's quicker than other methods. And so I just want to emphasize that to our parents today, that really helping your student learn the portal, then they'll really get the swing of it. And that's how they're going to do things. And they'll be able to be empowered to do it themselves. And that's the best part, is we're just at a point where we're trying to empower our students to learn how to do this themselves. And so we appreciate your partnership in helping with that. I just wanted to add that, Charlotte, because this is such a big thing that happens throughout the year too.
Thank you, Bridget. And I will add too that this often it's health information. It's protected private information. It needs to be contained in your electronic medical record. So this is how and why we use this method of communication. But thank you,
Charlotte, We got another question that's a really good question, and that is, what is the OPUS account? So OPUS stands for Online Pathway for University Students. And that we talk about a lot. And that's where your student records are, where they're little simple things like their name, address, their class schedule, their emergency contacts. That's where you go in and you also pay their bill. That'll be posted to the OPUS account. Your student should be giving you guest access to the OPUS account. The bills won't even be posted till mid-July, so you have a while on that. But OPUS is kind of a main access point. The students have to grant you access. They have to give you permission to see information on it, and they may only give you permission to pay their bill. They may not want you to see their grades, but that's what OPUS is. The patient portal is a whole different system, and it's your communication method with student health. Back to you, Charlotte.
Okay.
Oh, and so my colleague also wanted me to say, students also register for classes through the OPUS account. A lot happens through OPUS.
Mm-hmm.
Thank you.
Yep, you're welcome. And I can also say that your immunization status goes over to OPUS. So if you're out of compliance with your immunization records, that's how the hold gets placed on your account, preventing you from registering for classes. When you become fully compliant, then the hold gets lifted very soon after you send in your documentation and it's verified. Next slide, please. Okay, so now you have some questions why you're not compliant. And student health, we're still working on our 5,550 records of new students coming in this fall. It's about 2 days. We're going to say give us please 3 days, but you want to know, you can go on and see your status. And this is what it would look like when you look for your immunization record, when you can view it in the portal. This particular student, our test student, Mr. Greg Dooley, is missing his meningococcal for some reason, his tetanus, he's got a bunch of problems, and his varicella. So those are the vaccines that are missing, and you would need to send us the records, or maybe what has happened is you sent in the records, but something is incorrect, and we've messaged you through the portal. Or it's another thing that often happens, you come to Emory, you have a current tetanus shot, but as most of you may know, a tetanus shot is only good for 10 years. You got one when you were 11, now you're 21, we need you to get a new one. You can come in here to student health and get your tetanus shot, but now you need to meet the compliant requirement and get an updated tetanus shot in order to remain compliant with our immunization requirements. Now, I do want to make a couple of points here on this slide. You're going to submit your records through the portal. If you find that when you go to upload your records, the file is too big and it won't take it, you can email that record to immunizations-shs@emory.edu. If you are missing some vaccines, as you found out through your portal messaging, and you need to go to the doctor and get those, or go to a CVS Minute Clinic and get the missing vaccine, go ahead and do that and upload your records. If when you're filling out your immunization form, or you're looking at all of your records and you realize, oh my gosh, I'm still missing my second chickenpox vaccine, or I haven't had my COVID booster shot, we ask you not to wait until you're going to go get those. Go ahead and upload what you have today so we can start verifying and processing it. Then when you've made your appointment to go get the missing vaccines, upload that information at that time so that you're not delayed in providing the bulk of the information that we need. Now, the other thing, if you absolutely cannot get a COVID booster, get your tetanus shot, because we do understand that we do have a fair number of international students that may not have access to the vaccines that are required. We will have vaccine clinics on campus at the Student Health Center the week of August 15th. You can utilize those clinics on a walk-in basis, but we ask that you let us know why it is that you cannot make that July 1st deadline. What is the roadblock that is preventing you from meeting the immunization requirement by the July 1st deadline? We will work with you. on a case-by-case basis. But we expect you to meet the July 1st deadline unless you've communicated with us why this is an impossible deadline for you to meet. So let me talk a little bit about seasonal influenza. I mentioned it is a required vaccine. It's not flu season right now. You're not going to be able to get the new flu shot that is for the upcoming flu season. We're going to have it here for you on campus, so we're going to make it very easy for you to get a flu shot. We're going to be front and center where you could get it on your way to class. Watch for information about upcoming seasonal influenza vaccine clinics. It will be your responsibility to get the flu shot when it is available for the upcoming flu season. Other vaccines that are recommended but not absolutely required are listed here. Of course, we recommend you get these vaccines. If these are something that you haven't had yet, we have them here at Student Health. You certainly make an appointment while you're here as a student, and we'd be happy to vaccinate you with any of these vaccines. Again, we are here to help you. I don't want to make this sound like this is being penalized for not meeting our requirements and all of that. We really do want to help you meet this very important requirement. Go to our website, shs.emory.edu. You can access your portal. There's the URL. Remember the July 1st deadline. You've got FERPA forms to complete as well. You've got a consent form to complete if your child is under 18. If you want to complete the telehealth consent form ahead of time, you can do that. We'd like a health history from you as well. Remember, you can email us, immunizations-shs@emory.edu. Again, you can email us, send us messages through the portal, and you have our telephone number as well. So welcome to Emory. We're very happy to have you. And we look forward to meeting you when you arrive on campus.
Thank you so much, Charlotte. I thought this information was so helpful. It's your beginning for your students' health at Emory. And we're very fortunate at Emory because we have excellent healthcare, as I always say, walking distance to us. And so your students just have to walk very short way to get to really excellent healthcare. So thank you. As Charlotte said, if you have questions about student health and the immunizations, there is the email right there, immunizations-shs, student health service @emory.edu. If you have other questions, you can always reach out to family@emory.edu also. So our coming up with our next webinars next Friday is on health insurance. So we're going right through the health issues. After that, we'll be talking to you about accessibility services. If your student has special needs, that office will be here to talk with you about how to navigate campus with special needs. And then we'll talk about transition of care, which also will talk about mental health, other aspects of care. So we have June 31st, but guess what? There's not a June 31st. So we're just kind of teasing you to see if you're watching this. There is a July 1st, and we're giving you that day off because that's the holiday weekend. So we hope that we'll see you when we start these back up on July 8th. There'll be more after that. And we look forward to seeing you at our upcoming webinars. We do want to also give you the student health phone number, which is 404, area code 727-7551. But as we said, sometimes it's a lot quicker when you email or do through the patient portal. Thank you again, everyone, and we hope you have a great weekend.